right. Well, good morning, everyone.
Good
Welcome
morning.
to our,
How about
I
good
mean, good morning.
evening?
Might as well be morning. Good evening. Good day. Good day. Um,
Happy Monday.
Happy Monday. There you go. Happy Monday. Welcome to our panel, our tips and advice from our successful students. This isn't, of course, an exhaustive list of our successful students, but these are the students that have agreed to answer questions from us and from you guys. So I appreciate you guys being here. And we will go ahead and get started with the very first question. Number one, what was your biggest surprise when you first started nursing school? Now, this could be ADN, this could be your nursing classes at ECU, this could be a conglomeration, but what was your biggest surprise when you first started nursing school? Don't everybody jump at once.
Resounding crickets. Come on, Haley, you got this.
Honestly, my biggest surprise whenever I first started nursing school was the testing. I knew that the testing was going to be, or that there was going to be tests, but I didn't know how extensive the tests were going to be, and the situations, the questions that were asked, just like the clinical scenarios within the questions on the testing was probably my biggest surprise. Just talking to everybody else before nursing school, it was a lot of, papers, you have your quizzes, clinical scenarios, but the tests were, I think, really challenging and surprising for me, especially on the first one.
I think I can jump in off of that just because the tests are such a big deal. So for someone like me who never studied in high school, you've got to study. You've got to understand like 100% of your time during your school days has got to go to school. I mean, that being said, you do need to still have, your own cup being full. You need to have time for yourself, do things that help, re-energize you, but be prepared to study a lot more than you probably ever have or ever will study.
Awesome. All right. So, kind of going off of that, how did you prepare before the first semester began?
I went on Amazon. Bought a lot of things that I didn't ever use. But
for me personally, I don't really think there was that much that you could do to prepare for your first semester of nursing school. I think that enjoying your time off is the best because once it starts, it's 2 years of just busyness and your breaks. Sometimes you get a break, but a lot of times your break isn't actually a break. You're still studying and doing stuff. So I think as long as you have your supplies and stuff that you know you have to have ahead of time, then don't stress yourself out with trying to study material and do like prepare in that way before.
Nice.
If you're like me though and you have to do something to prepare, or a little bit OCD, I think it's really good to get into a routine before nursing school of just like, hey, I'm gonna wake up at this time every day 2 weeks before I start school, or I'm gonna go on YouTube or listen to podcasts of successful nursing students, successful people within the medical and health professional field, look at different policies of the hospital, just like gaining kind of like an understanding, getting into a routine. I think is the best thing I did before nursing school, but also enjoying myself, definitely.
All right. So, if you could go back to the first week of nursing school, what advice would you give yourself?
I would definitely say like I'm someone who comes from absolutely no healthcare background. Like neither one of my parents work in healthcare. I came straight out of high school with no healthcare experience. You're going to hear a lot of people who know a lot more of the medical jargon and have been around the hospital and stuff, but at the end of the day, you're all in the same spot. So it does not matter how much more someone might know now because you're all in school to be a nurse because none of you in that room have been nurses yet. So you go through that first 2, 3 semesters and it does kind of feel overwhelming. You see the person next to you, like there's a guy in my program who's been an RT for 10 years. He's saying words that I've never heard of before, and even some of the nurses that are instructing us have never heard before because of his experience. But now I'm at a point where if I don't know what he's saying, it's because it's something specific to being an RT and not relevant to nursing. Or heck, he's one of the people I study with. So me and him are teaching each other at this point. So don't let the people that you think might know more than you make you either more timid to ask questions or shy away from trying to learn, because you're all in a spot paying money to a school so you can learn to be a nurse. And nobody in that room is a nurse yet.
I would agree with that.
All right. So, how did you balance the excitement with the reality of how challenging nursing school can be?
I mean, I didn't like know what nursing school was going to be like. And like, I came from like, I'd been in an actual school for a long, long time because I was homeschooled before. So I was more so excited about everything. And I mean, like, there's definitely a reality check. Definitely like your first day, you're like, oh my gosh, this is like so much is happening all at once. But I mean, don't like, definitely stay excited, because if you get to a point where you just don't like it anymore, it's hard to keep going. So always keep that excitement, even in reality.
I like that. All right. All right. So, going on to studying and time management, what study methods worked best for you in nursing school? Work best for you in nursing school?
When I was in nursing
Um,
school,
oh, sorry.
go ahead, Delaney.
Sorry.
No, you're good.
For me personally, what worked best is I always, type my lecture notes, whatever that they went over in class, and then I would go through. It was called like the Saunders book or whatever, and I would go through and handwrite all of that. I found a instructor on YouTube that I really liked. Her name, she was like Nexus Nursing. I don't know what her actual name is, but I watched her videos on all the topics that we were going over before tests, and I would write down, key points that she made. And then the night before tests, I would, with my study group, go through like all of my written notes combined, and I would test them. So it kind of worked for them. It also worked for me, as in like teaching it helped kind of bring it to the forefront of my brain and keep it, right there for the test the next day.
I agree with those. I also did like different things. Like I would study with a group, and I think talking it through with a group is definitely very helpful. And then also doing a lot of practice questions helped me. I went to Pitt and we had like a specific thing where we could go do practice questions. And so I'm sure other community colleges have very similar things, or you can pull them up somewhere. But practice questions definitely help because it prepares you to get in the mindset of answering nursing school test questions because they're very different than other tests. And then I also watched a lot of YouTube videos. There's all kinds. There's like Simple Nursing is a really good one. Nexus Nursing, like Delaney said, I watched her a lot. Um, Level Up RN, all of those are really good channels to watch. And then I also did a whiteboard. That was probably the most helpful thing for me personally when I was by myself. I would get a whiteboard, and if I was doing like heart failure, I'd write heart failure and I'd write all the signs and symptoms, the management, the interventions, like all the things. And I would do that for all of the topics that I had to do. And I would take pictures of it, look back at that before the test. I would even, I lived at the time 30 minutes from the community college. So I would video myself talking through like the main points from my whiteboard. And then at the end of the video, I would ask myself questions and then I would listen to it on the way to class. And then I would like quiz myself straight from my notes. And that really helped me.
I will say, to piggyback off of the practice questions, if your college doesn't have like a bank for you to use, or you run out of questions in like the textbooks, on Quizlet, if you specify which topic you're looking for and then NCLEX style question, when you search it up, you get amazing questions, and a lot of them come with rationales. Make sure you find the ones with rationales in them, because if it just like has the question and then like on the other side of it just says like A or B, that's not a good one. You need to specify for rationales, and that gives like the explanation, because a lot of the times those are coming from like test banks, but it's not buying a test bank. So there is a difference there. And it's really helpful because it's extra questions that you might not have access to through your textbooks or your college. And it's just, there's thousands of them, and you can just sit there doing questions and questions.
Going right off that, if you in some way or form run out of all of those questions, I'm not personally one who does this, but I know of a lot of people I'm at Pitt that do this. They take their entire summarized notes and they put them in whatever form of AI they want to use. ChatGPT is the one I hear the most, and they give it a very specific prompt of I only want NCLEX style questions from this material using answers that are only found from this material in like whatever format they're looking for. So it could be like NGN questions, which are less ABCD and more like types of things you have to incorporate. And that will give you literally infinite amounts of questions on your exact material from the notes you made. I think that's just a good way to kind of make sure you know what you know, because sometimes it will just add a little bit of reinforcement on like maybe a side effect of a medication that you just can't seem to stick. But then when you're doing a select all question and you get it wrong, because it will give you all the like correct answers at the end, it might just help build up just like all the other practice questions.
I'll piggyback off of Matthew and say that I actually did do that, especially if there weren't like a lot of questions in the book about it. And I found it very helpful. I always just made sure to include, with rationale, so it would use my notes and give me, the reason why the question was, I got it right or wrong at the end. And I always found that super, super helpful too, because it wasn't the same, 20 practice questions that I've done 50 times over and over again before a test.
I love that. I love how y'all are using like AI and like um that sort of thing for good. I mean that's really, really cool. That's really, really neat. And it's neat to hear like all of your different the ways that you're using it too. Like I would have never thought to do some of that, but interesting. You guys are so smart. That's why I wanted y'all to do this. All right, we're gonna skip around a little bit. So how did you manage your time between class, clinical, work, and personal life?
Not very well. You don't have a lot of personal time. I mean, like you have like what Trista said, like you have breaks, but a lot of the times like they're only like a week long, or like even when you're on break, you have things to do. Like I remember Christmas break one year, we had like 50 drug sheets to fill out. And so even though we were on break, we still had stuff to do. But I think it's really important to find time to do stuff for yourself. And like even if you're studying, like find a spot like a coffee shop that you like, or like a restaurant like Panera or something that you really like to go to. So it's kind of for yourself and it's also for school. So that way you could do both at the same time.
Yeah, I would agree with that. I would go to Giddy Up a lot, and that would help me like feel like I was getting away because a lot of my friends would study in the library, and I would do that sometimes too, but sometimes I got so tired of being in there or being in the same apartment. So going somewhere else that I liked, like Giddy Up, was just like help me get in a better headspace. And then I would also like plan out when I was gonna like take breaks. So like if I knew that I had all day to study, I would say I'm gonna study from 9 to 10:30, and then I'm gonna go eat breakfast, and then I'm gonna go from 10:30 to 12:30, and then I'll go do this. Like, and I literally would do that, and it would help me like get to a goal instead of me just like studying hours on end, which I still did do that sometimes too, but it is good to have a balance if you can.
I will definitely say, like Trista just said, having a balance is extremely important for your mental health and for your nursing degree. I think the times that I took more time off of studying before a test and just kind of relaxed and gave myself that mental space, I was much more successful than hammering out studying 6 hours a day every day of the week. I think it's very important. And I also will say, somebody told me at the very beginning of nursing school that nobody really understands what you're going through other than yourself and your peers that are in nursing school. And that's very true. So don't feel guilty about not being able to spend time with your family or friends. Um, in the end, it's going to be worth it. 2 years strong and then you're good. But yeah, definitely find a balance. It's very important.
So what resources like apps, planners, study groups, whatever, what helped you stay organized I already heard the whiteboard. I love the whiteboard idea, Trista. But what else helps y'all stay organized and on track?
I love a good Quizlet. So that way you can like take it with you.
Definitely a planner. If you're doing ribbon, you have your ECU classes and then your community college classes. I always set my ECU classes a week before the due date, so that way I wouldn't get all caught up in, oh my goodness, I've got one more day to do this. I kind of got in the mind space, okay, I gotta do this today, but it really wasn't due for a week. So just using a planner, using a calendar. I use color coded too. So.
Yeah, I would agree with that. I think that there were definitely times when balancing like online ECU classes, clinical, and my community college did not a lot, but there were definitely times where that was very hard. So I would definitely say like knowing ahead of time, like you have an ECU assignment due Sunday, but if you have clinical Friday and Saturday, then really you have to have it done before Friday. So like thinking ahead and like writing that out, thinking through those things would be very beneficial because it's stressful when you realize Friday afternoon, oh my gosh, this assignment's due tomorrow night and I have clinical all day tomorrow. When am I supposed to do this? So you don't want to get yourself in those kind of situations.
All right, we're gonna move on, switch gears a little bit. Now, think back to clinical. What helped you feel more confident during your first clinical rotations?
This isn't something I did, but it's something I definitely wish I did. Like I said earlier, I had no healthcare experience, and I'm one of those people that like when I'm doing something completely new and I have no idea what it's going to be like, the anxiety buildup is worse than what it actually is. So if you have the time or the chance, I highly, highly, highly recommend to go shadow just the hospital. I mean, I couldn't even tell you what the floors looked like prior to clinical, let alone like what a specific unit or room looked like. But one, it's just beneficial because you get to see things that you will potentially never see again, depending on what unit or floor you shadow. And it just allows you to kind of have a little bit more comfort. Now, I'm not saying if you get assigned to SIU that you have to go shadow SIU beforehand. But I definitely think just going to shadow maybe one ICU, one intermediate, and one med surge floor. Honestly, you could take or leave the med surge floor because they're just kind of exactly what you imagine a hospital to be like. It will make it way less anxiety inducing as someone who gets anxiety from having no idea what the heck's going on around them.
Something I did that helped me was I always got really nervous about not knowing where to go because I didn't know my way around the hospital or like the outside parking lots or any of that really stressed me out. Especially like ECU Health, the medical center, it's huge if you've never been there. So I found out where I was supposed to go and I literally drove there before and found the parking lot I was supposed to park at and made sure that I knew like what doors to enter in so that that way I didn't have to worry about, you know, getting lost because you can get lost out there, especially if you're new to like the area. Because I know even outside community colleges sometimes use ECU Health Medical Center. So a lot of people haven't been to the hospital before. And I would say get there early, and you're going to be nervous. There's not really anything you can do to like make yourself not be nervous. Like everybody's nervous. Just remember that some of the nurses on the floor will be excited to have students, some of them will not. Don't take that personal. Just go with it. I mean, I've had some nurses be really nice to me when I was in school, and then some were definitely not. So just know that it's not personal. They're probably just stressed out and have stuff going on. So do what you can, but it's normal to be nervous.
And I will say, volunteer yourself for everything. It doesn't matter if you have no idea what's going on or if you're so nervous because you've never seen this skill done before at all. They will not let you hurt somebody. And most likely, you're not going to be on your own if it's something completely new to you. Volunteer yourself for everything because it shows that you want to be there because it is an interview when you're there. They do talk. And it also just grows your skills and your confidence eventually, because you can be like, I saw this done before, or you know what to do for next time, and you can confidently or more confidently do it a little bit more by yourself. And it really helps develop once they like assign you patients to fully take care of by yourself in clinicals.
Well, you just answered the next question, because I was going to say, what are some tips for making the most out of clinical experiences? And that's exactly what I was looking for somebody to say. So good job, Jaslyn. Working ahead. All right. So moving on a little bit, for some support and community. So who or what helped you get through the tough times in the program?
I would say find one person. You only need one person. Find your one person, whether they're in the program or outside of the program. I will say if they're outside the program, they're going to have no idea what you're talking about, and you're probably going to get frustrated trying to explain things, because not only do you have to define them before you can even tell them what's going on. So that is a little bit of a caveat to that if your person ends up being outside the program. But if you can find somebody in that program and make them your person, it makes things a lot easier.
I agree with that. And I would also say finding somebody like on day one, I always tell people this, try to find you either one or two people in your group, in your nursing program that you can study with. It makes things so much easier. I know I waited until like almost my entire second semester was over before I really got a study group together. And it made my first 2 semesters very, very difficult because I was pretty much doing it all by myself. And once I started studying with groups, my grades went up tremendously. So I would definitely say do not be scared to approach someone when you're in class or when you're in like labs and stuff, especially those first couple of weeks because everybody's nervous. A lot of people don't know each other. They're all feeling the same things that you're feeling. So just say, hey, you want to go study in the library together later, or try to start those conversations because it will definitely be worth it.
I was just gonna add, coming from the like male point of view, there's only a few of us in those rooms, so point each other out, talk to each other. I got lucky. My pit cohort, I think we have like 17 or 18 guys now, and we started with well over 20 out of like a 80-person class. So that's a very high ratio of male, like future male nurses. But even like our younger cohort only has, I want to say 5 or 6 that are in like the AM and PM classes. But I know that that's a group of guys now that are there and they can talk to each other. And while you're going to have friends with everyone, it's just easier on that first day to go, hey, we have something in common. And it's easier to talk about that than going around and trying to talk with a bunch of random people. Because when there's only 3 of you in the room, there's only 3 people that you get to talk to about that.
Interesting perspective. All right. So y'all are like skipping all around all my questions here. So let me hold on. All right. So going along with support, how important is communication with your instructors?
Really, really important. Like I found like the most important thing is like no one can help you if you don't say something. Like no one can help you when you're drowning, when you're already in the middle of the ocean. Like somebody has to know to pull you back. It's like communicate with your teachers because they're not going to judge you. They're there to help you. Like find one teacher at least that you really trust and that you really respect and that you look up to, and talk to them about everything. Like not just school. Like if you're having a hard time in life, like they're going to listen to you for that too.
I will say, if your instructors have office hours, go to them, especially after an exam. Even if you passed, even if you did amazing on the exam, there's still questions you probably missed, and it doesn't hurt anybody to just go over those questions with them during their office hours. Honestly, going to them after an exam, no matter the result, is very beneficial. I probably would not be a nurse right now if I didn't go after several of my exams and go over questions that I missed. it's just a very good resource.
All right, moving on. Mindset and motivation. We kind of hit on some of these already, but here's one. How did you keep a positive mindset before major exams or clinical evaluations?
I would say do not let other people like rub off on you. I think sometimes, honestly, at least with my experience, nursing school, some people can be kind of like negative after test if they didn't feel good about it, or like they'll think it's like cool. Not everybody, but some people think it's like cool to have like that, like, oh, school, this sucks, like mindset, but like it really can rub off on you. So like don't have the attitude yourself, but also don't let other people's attitude like that rub off on you, because although like everybody says like it's 2 years you can get through it, which is true, it's still 2 years of your life and you don't want to be like miserable for 2 years. And it's definitely like I was not like there were definitely times where I was stressed and doing stuff, but you don't have to be miserable. So know that like balance. If you start to notice people like that, don't let yourself like fall into that stigmatism type thing.
I love that. We can see that from our point of view too. Speaking from Miss Bass and myself, we can see that. We can, and it's amazing the people that are positive and have positive mindsets going into it, even on the hard days. You guys are the most successful because it's you can get through it. All right. So what habits or lessons from nursing school do you think will help you most as a new nurse?
Be like slow about what you're doing. Like think about every step that you do before you do it. Because I've even in my like 6 months of being a nurse, I've seen so many people make mistakes because they're rushing. And like, yes, you get busy, and yes, like you've got so many things to do, but the time you take to slow down and make sure you're doing your safety checks and all that stuff, it really helps because it helps you also think about what you're doing. And sometimes you like doctors or other nurses, they'll miss stuff that if you don't take the time to critically think about it, like you're gonna miss it. So it can be really helpful to slow down.
Going off what Abby said with slowing down, I think time management and documentation are two really big things going into nursing and nursing field. Like documentation is so important. I can't stress that enough. Working in an ICU or any hospital setting, you never know what's going to come up in the future. So I always make sure I document anytime I reach out to a provider or anytime I have a communication with a family member and advocating for my patients. I think something I learned in the clinical setting, and it's really helped me a lot as a nurse now and my patients too.
Yeah, I agree with all of those. And I'd want to add to like, you do need to slow down. You do need to do all of those things. Those are true. But I would also say, like, be confident in yourself, not overly confident. Like, there's a fine line. But I think, like, at least for me, I was very intimidated my first, like, 2 semesters of nursing school because I was one of the youngest in my class. And, like, if you're in ribbon, then you're going to be one of the younger ones in your class. And you see all of these people, like, some of them may have experience, some of them may not, but you think like, oh my gosh, they are ahead of me or they're doing better. But like being confident in what you're doing and asking questions when appropriate is very much something that I learned in nursing school. I learned it later in nursing school, but it definitely has helped me as a nurse now. These last few months, I'm way more comfortable speaking with like, providers, respiratory therapists, family members, that kind of stuff did intimidate me a lot in nursing school. But my senior year of nursing school, I got a lot better at that. And then I can tell a big difference now. So I would definitely think don't let that kind of stuff intimidate you.
All right. 2 more questions. How did nursing school change your perspective on the nursing profession?
I think there's so much that nurses do that as a nursing student or like someone just off the street you don't really know. Like we have so many little jobs that you wouldn't even think of until you've done it or till you're in nursing school and you've like seen it be done by other nurses.
It just gave me a lot of respect for nurses. Like after going through nursing school, like it's very hard, and 2 to 4 years of just doing that consistently, it gave me a very deep understanding and appreciation for the people that do it and can even continue on to go do other things like any kind of medical. I'm like, they deserve it because their school was not easy. So gave me firsthand experience.
I think it gives a lot of insight into the different avenues that you can go into as a nurse, because a lot of the time when people think of like a nurse that works at a hospital, they're thinking of an ER nurse or a med surg nurse. You're not really seeing all the different other areas that nurses are in. I think nursing school does a good job of making sure that you get to go see all the different places in the hospital, to expose you to how the hospital is really run with all these different positions, but then also shows you where you could go outside of like the ICU or ER meds.
Interesting. All right, one more question. What do you wish incoming students knew about success beyond grades?
I
Ooh,
think
did I
like
stump you? No, I'm just kidding.
I think that like grades, yes, there's a lot of like oh, sorry, my dog's crying. There's a lot of success between like, you want to get good grades, you want to get A's, you want to get B's, but like the feeling of helping other people is also something that can be successful, like recognition from your family, other families, like patients, other actual nurses, or like just your classmates. So it's really nice too.
This is something I struggle with a lot. When you make a good grade, or if you, as long as you pass the test, that is a little victory that you need to take. Do not compare it to your friends. Do not compare it to your other peers. It does not matter. You will probably never make the best grades in the class. That's not your goal. Your goal is not to be the valedictorian. And if it is, I wish you the best. That's too much stress, and I don't want that. I simply just want to pass a test. So, and I know I'm bad at it, but like if I come out of a test with like an 85, I just made a B on a 7 point grade scale, I should be thrilled. Don't compare that to the person next to you who made a 90 because they're doing their own work, they're doing their own practices, or they might have just had a good test. We all know that once you get into nursing school, you'll understand it more. Those tests, there's so many questions that are up in the air, and you could fluctuate 5, 10 points on your test just based on if you guessed right that day. The grade is the least important thing as long as it's passing. And if it's not, I'm confident that every single person in this call has failed at least one nursing test. It's not the end of the world. They're always recoverable. Just don't worry too much about the number and just focus on yourself, focus on your actual study habits. And if you're doing everything you're supposed to be doing, I promise the passing grades and good grades will come later.
To kind of piggyback off that, I was just gonna say, like, if you do get a bad grade on a test, don't let that like get you down, because I know I have failed or did really bad on several tests and I still passed. So don't let like one or two bad tests make you think that you're not going to be a nurse and you're going to fail nursing school. It's okay. Just study more for the next one, study different for the next one if you feel like your study habits or maybe what helped you or what made you not pass. Study differently if you need to, study more, but don't let it like wreck your confidence, and then because then you might do bad on the next one too.
Yeah, I was never a good test taker, but I think the most important part of nursing school is learning how to be a good nurse, and grades do not define you, as everybody else has said. I think it's really important to get the most clinical experience you can, building relationships, learning how to build rapport with your patients, learning how to educate your patients. Like you can have so much success apart from your grades, just learning how to be a good nurse in the clinical setting. I think is the most important and what you will carry with you throughout your entire career. And yeah.
I think people need to remember that while grades are important, they aren't everything. And a lot of times people need a reminder of why they went to nursing school in the first place. You went there to learn how to help people. Um, and so obviously you need to be able to pass a test, but you can look in the profession, see, there's a lot of nurses out there that are super, super smart, but their bedside manner is terrible. And there's other nurses that, struggle with certain things, but they actually have good relationships with their patients. So you need to make sure that, every day you go into work or you go into clinical, you're going in with an open mindset to not there, to be the smartest person, but to be there to help someone.
All great advice. And that's why we did this, because you guys are you give really good advice, and I've heard it bits and pieces here and there from different things that we've done, but I wanted to put it all in one bubble to have it all, so we could answer any questions that some of these other students might have. So I know there's a few students on the call. If any of y'all have any questions, feel free to either unmute or put them in the chat. I know sometimes the chat is a little less intimidating when there's a lot of people, little eyes looking at you. So if you want to, if you have any questions that you want them to try to answer, feel free to put it in the chat. And while we're doing that, while we're waiting to see if we get any questions, how about each one of y'all give like your parting words of wisdom? Like if I could say, tell me one thing that you've learned over these years, either in clinical or in classroom or in your ECU classes or in your community college classes, what is one thing that you wish everybody would know?
I think it's going to sound lame, but enjoy it. You're only in nursing school once. It does suck most of the time, but you're with a bunch of people that are with the same mindsets as you, have the same drive as you, going through the same crap that you're going through. You make a lot of really good friendships, connections. Like I've got friends now that I know I'll probably have for the rest of my life just because I met them at this time in nursing school. Like I said, it does stink. There's a lot of really hard parts, but there is nothing more rewarding when you finish it, getting to say that you went through that and you succeeded and you finished it.
I'll go next. I agree with that. I definitely think that meeting people in your cohort is very important because like there is several people that I work with now that I was in clinical and nursing school with, and our friendship is like we're very, very close. Like we got close very fast, and we will be friends forever. We talk about it all the time. And it's so nice to like now that we're outside of nursing school to like look back at it and laugh, and you have all those memories of like those nights where you were studying and it was hard and stuff. And in the moment it's very hard, but it is fun to look back at and know that like it was definitely worth it.
I'll kind of say, pretty much even, there's going to be some nights where you're studying and it's really tough and it feels like, it's impossible, like you're not going to pass a test or you're not going to even pass the class. And you need to not pretty much give up on yourself, give yourself some credit. You've gotten this far. It might seem impossible, but, you know, you might surprise yourself and do something that you don't think that you were ever able to do.
I would say looking back, being a nurse now is extremely rewarding, so continue to push through. It takes a lot of grit, it takes a lot of resilience, but also know that if you rely on motivation throughout nursing school, some things will never get done. So my motto is always discipline over motivation. Stay disciplined the entire time, work hard, and the outcome is awesome. I love it.
I like that.
I
You
think
said
that like
a lot.
you're gonna get burnt out for sure. And I always have to remember why I started, whether it be for yourself, for your parents, for your significant other, for your children, for your dog. Like always keep that in mind when it gets hard because they're going to be your main reason and your main support system.
I also want to like add really quick to like connect with your patients. Like there is one patient from my first week or my first semester of nursing school that I still remember everything about him. And because he was just the sweetest little old man in the whole world, and I still remember him. And I remember sitting and talking with him for an hour just about his whatever he was talking about. So I definitely think that connecting with your patients is very very rewarding. I work with babies now, so I don't really get to connect with my patients as much. I have their families that I get to speak with, and that's a different kind of special, but definitely connecting with your patients in nursing school. And I will say a lot of patients, not all of them, but a lot of patients really like students. Like they think it's like fun to have like a student with them for the day, and they get excited. And so definitely like chat with them, connect with them. It's worth it.
All right.
There's
we-
a-
we-
Sorry.
I was just
everybody-
going to respond to the chat question. They
Oh,
asked
yeah,
about clinical
thanks.
hours.
Thanks, Matt.
I'm at Pitt right now, so that's the best example I could give. We're about to start our last semester, and they did just make a change. So typically, our semesters would be you'd get assigned to a clinical floor. You would go at most 3, but usually it's 1 or 2 days a week. You would go for about 8 to 12 hours. These last like summer and this semester we go for 12. Your first 2 semesters we went for around 10. But Pitt just made a change so that this very last semester, our senior semester, we're gonna have a preceptorship for half of our semester and a regular clinical for the second half. The preceptorship, we don't really know everything, but from what it sounds like, we basically get to pick our schedule between Wednesday and Saturday, and we need to go to, I believe it's 2 a day, 2 shifts. They can be night shift, they can be day shift, they can be whatever. We're going to get the floor and unit assigned to us based on grades, and yeah, that's pretty much it. So it's pretty similar to the schedule that an actual nurse works, plus or minus 1 or 2 days, and then it changes throughout each semester. But I hope that answers that question.
Thank you, Matt. All right. Well, I'm not seeing any more questions, and so we are going to wrap this up because it's Monday. And I know everybody has a lot of things that they need to do and to catch up on and, sleep, work, schoolwork, all the things. So thank you to all of our panelists. I really, really appreciate you guys giving your time to do this for me and for us. I will be in touch about some goodies that I'm going to send you guys for helping out because I really, really appreciate you giving out your knowledge because I know you have a million other things that you could be doing. But I'm going to stop recording now.